Heart attacks and anxiety can often feel alarmingly similar, making it challenging to differentiate between the two without medical expertise. A heart attack typically presents with intense chest pain or pressure, often radiating to the arm or jaw, shortness of breath, and possibly cold sweats, nausea, or lightheadedness. In contrast, anxiety attacks can mimic these symptoms, but are also marked by overwhelming feelings of fear or panic, a sense of impending doom, and rapid heartbeat that usually come on in response to stressors and may resolve once the stressor is removed. Immediate medical evaluation is crucial for heart attacks and can involve medications to dissolve clots and procedures to restore blood flow to the heart, while anxiety is usually managed with therapy, medication, and lifestyle changes over time. Risk factors for a heart attack include smoking, high blood pressure, high cholesterol, obesity, and a sedentary lifestyle, whereas anxiety can be influenced by genetics, stress, trauma, and other psychological conditions. Here's a closer look at the detailed aspects of these conditions to better understand their nuances and implications. Affected systems, cardiovascular versus psychological. Heart attack symptoms and anxiety attacks can often be confused due to their overlapping manifestations, such as chest pain, palpitations, shortness of breath, and a sense of impending doom. A heart attack typically involves the cardiovascular system, where blood flow to the heart muscle is blocked, often by a clot, which can cause tissue damage. Anxiety attacks, on the other hand, stem from the psychological system, triggered by stressors or panic disorders, without physical blockage in the heart. It is crucial for both patients and clinicians to distinguish between the two, as the treatments differ significantly. A heart attack requires immediate medical intervention to restore blood flow and minimize heart damage, whereas anxiety attacks are managed with psychological support and, if necessary, medication to control stress responses. Pain characteristic: crushing versus sharp or dull. Heart attack pain is often described as an intense, crushing sensation that may radiate to the left arm, neck, or jaw. It typically persists for more than a few minutes and can be accompanied by sweating, nausea, or shortness of breath. Conversely, the pain associated with anxiety is commonly sharp or dull and may be accompanied by a rapid heartbeat, hyperventilation, or a sense of impending doom. Anxiety pain is often fleeting and can move around to different areas of the body. Distinguishing between the two conditions is crucial since a heart attack is a life-threatening medical emergency, whereas anxiety, though severely uncomfortable, is not immediately life-threatening. Prompt medical evaluation is essential when in doubt to ensure the right course of treatment. Onset of symptoms, sudden versus gradual. In distinguishing between a heart attack and anxiety, the onset of symptoms plays a critical role. Heart attack symptoms typically strike suddenly and have an acute presentation, often described as a crushing or squeezing chest pain that may radiate to the arm, neck, or jaw. In contrast, anxiety symptoms tend to develop more gradually and can fluctuate in intensity over minutes to hours. Anxiety-related chest discomfort is often described as a sharp or stabbing sensation localized to one area and is frequently accompanied by a rapid heartbeat, shortness of breath, and a sense of dread. Understanding this temporal pattern is essential in guiding appropriate and timely medical responses for these potentially life-threatening conditions. Associated symptoms: shortness of breath and nausea versus hypervigilance and restlessness. When differentiating between heart attack symptoms and those stemming from anxiety, a key element lies in the associated symptoms. Both conditions can cause shortness of breath and nausea, creating diagnostic confusion. However, a heart attack often presents with acute, crushing chest pain that may radiate to the shoulder, neck, or arm, and is accompanied by a sense of impending doom. In contrast, anxiety is characterized by hypervigilance and restlessness, where individuals may experience a rapid heartbeat, muscle tension, and an overwhelming sense of worry or panic. The intensity of anxiety symptoms can fluctuate, and they often occur in bursts or as a response to stressors, unlike the severe and unprovoked symptoms of a heart attack. Recognizing these nuances is critical, as timely and appropriate response to heart attacks is vital in ensuring the best possible outcomes. Trigger factors: Physical exertion versus stressful situations. Physical exertion is a key trigger for heart attack symptoms. Typically, with a heart attack, chest discomfort or pain occurs when the heart muscle doesn't get enough oxygen rich blood, and physical activity can exacerbate this condition. The pain might be severe and can be accompanied by shortness of breath, sweating, and nausea. On the other hand, anxiety often gives rise to symptoms during stressful situations rather than physical strain. The body's response to stress can mimic those of a heart attack, including chest pain or discomfort, rapid heartbeat, and breathing problems. However, anxiety-driven symptoms are usually linked with a heightened state of arousal in the nervous system due to stress, worry, or fear, rather than a circulatory blockage impeding blood flow to the heart. Distinguishing between the two can be challenging, but it's critical because the right diagnosis can mean the difference between life-saving medical intervention and psychological therapies like counseling or medication to manage anxiety.